specifically for folks that are low and moderate income. So it's not a center specifically for folks that are experiencing homelessness. It's for anyone low or moderate income, and then really anyone is welcome to stop by, and anyone that's looking for help, being referred to services or resources, or can stop by and receive some, attend some of our programs. Right now it's relatively low overhead. We have 3 part-time staff overseeing the resource center, but we really are hoping to expand that and really expand our hours and the offerings.
Let's see. So in terms of the scope of services, I was talking with Jacob from CARE, and he had explained that, like you kind of were alluding to this earlier, this is not a base level service center. So people who are dealing with very serious addiction issues or behavioral health issues, they can come here and will get redirected probably to somewhere better suited for their needs. Is that right?
Yeah, so if someone's having any sort of emergency, they should not come to this building. This is not a place for emergency response. If someone came through here and really was in need of either behavioral health or mental health intervention, we would definitely call out our Jacob and his care team, and they would kind of do a warm handoff off to them. They're the experts in to respond to those sort of things. They are the city's mobile crisis response team, so they would be able to do that. Here in Eureka, there is a Semper Virens over on Wood Street. That would be that would be a great resource for folks that were looking for services for mental and behavioral health.
Right.
This is a place that it's really a platform for our staff to expand and really have bring in the public and offer our services to a wider population. And so the 2 main things that our staff currently kind of specializes in is housing and employment. And so, we have our workforce development programs, we have our job placement programs, we have all of those things. Some of those programs are still, like Pathway to Payday, still happening at Betty's. We're not changing that at all. But we're offering job readiness programs here. We're also going to be offering unfortunately, there's just not enough housing. There's a housing crisis, there's a housing shortage. There's just not enough housing, and there's also not enough funding for permanent supportive housing and for rapid rehousing programs. So we do operate a rapid rehousing program. I don't want folks to get the wrong idea. If they just show up here, they're going to get housing.
Right.
The city doesn't own housing that they rent out to folks. We have to work directly with property owners, with property management companies, with landlords.
Yeah.
And so there's rules and regulations. We need to help folks that are have the highest need and have the highest vulnerability. So we are continuing to operate our rapid rehousing program. But in addition to that, we're going to be offering a couple of different programs. One's called, I think, Highway to Housing. It's kind of how to get your ducks in a row, how to get set up, kind of knowing what the expectations are, getting, if you need help getting your credit score up. It's kind of what to expect from applying for housing and what that looks like. And then another program about once you are housed, like what are your roles and responsibilities? What's the landlord's? What are their rights and responsibilities? What your rights and responsibilities are, and then also how to maintain your property, what to look out for, how to communicate effectively with your neighbors and your landlord, and how to keep that housing. And so we'll be offering both of those here on site. And then for we have computers that are open to the public. So if you want to come down and use those computers to apply for housing, if you want to use those to apply for employment, if you need documents, if you need help, getting signed up for, we're not issuing, social security cards and driver's license and identification cards, but we have a lot of those forms here, and we can get you set up. We can go through that process, and we will, there's a phone. If you need to call a place, sometimes with some of these services, you have to be on hold for an hour. And so we have a room you can sit in. If you need to be on hold for an hour with another agency, we have a comfortable place for you to do that. And we have staff here that's going to help you, walk through that process. And we also have this nice conference room that's open to any community partner that wants to come in and deliver services here. Come on down. That space. This is a community center, so it's not just the city of Eureka providing these services. It's really a place for the community to come together and provide these services. So whether you want to distribute free cell phones or sign people up for CalFresh or Medi-Cal or Medicare, whatever it is, that conference room is available for you to come here and set up and provide those services. And so, yeah, our resource center coordinators are very trained and very knowledgeable about the local resources here and how to connect people with those. We have really great relationships with dozens and dozens and dozens of local agencies. And so, not only do we know, like, hey, you need to go to this place, we can probably tell you exactly, where to go and what forms you're going to need and who to talk to and if it's the door on the left or the door on the right. And so it's this is like this is the no wrong door policy, where whatever you're looking for, whatever you need help with, you came to the right place, because we're either going to help you ourselves, or we're going to we know who would provide those services, and you might be a few steps ahead. So when you show up, you're going to have the form already filled out. You're going to know what that process looks like. And so, yeah, we're not duplicating services. All the programs that we have are very unique, innovative programs.
Right.
And throughout, I've worked with the city for over 8 years now, and it's been very, very clear. The closer we work with our community partners, the more impact you can have. And so we're not interested in duplicating services. We really...
So this is complementary, really, to what Betty Chin is offering, and the rescue mission also plays a good part in sort of assisting people to get to the point to where they're ready for social services that are offered here.
Yeah, and we work extremely close with those organizations, with Betty. Like I said, we have joint, not only, with Pathway to Payday is a great example of this. It happens at Betty's Day Center with City of Eureka staff, and then also with county staff from the Department of Health and Human Services. It's one workshop that we do about every other month. We do it quarterly, so 4 times a year. And we have these 3 organizations come together to really provide that service. So it's not duplicating. We're really coming together and complementing and supplementing and collaborating. The rescue mission is a great community partner. We work really closely with them, whether it's for our overflow shelter or with some other programs. We used to have, prior to COVID, we used to have weekly meetings at both of the centers. We work extremely closely with St. Vincent de Paul and Freemeal. We're down there, 5 days a week. Our outreach workers are down there. We're doing housing assessments down there 5 days a week. That's kind of the hub of services, and that's where our outreach workers are in the mornings and the afternoons, and then later in the day they're out going to where folks are, in encampments and throughout the town. Outreach is another big component, and so our outreach workers are outreaching. They're not really here so much, but they're out in the community where folks are. And
outreach happens out.
Yes. And so, I could probably mention 30 or 40 organizations that we've worked with either extremely closely or just collaborate on a couple things. And if there's an organization out there that's never worked with the city, or it's been quite some time, like, reach out to, like, we're here, like, we play nice, and we'll work with anybody that wants to work with us. And so come down and check out the resource center. It's 1111 East Street. It's the back of the municipal auditorium. It's between the beautiful mural between the otters and the condors, the big purple door. Come by and check it out. Right now it's 10 to 2 Monday through Friday, but we are going to be expanding those hours once we have some services. We think that's what's it's going to be asked of us, but if there's a demand for other services, we have a great history of being innovative and creating programs to meet demand, and so we're ready to do that. And then if folks are showing up early, we're prepared to open early. If folks are showing up later in the day after we're closed, we're prepared to modify that schedule. So we still have those soft opening hours. Just we don't know which way to expand quite yet. But we are ready to get feedback and to modify our approach to fit the needs of this community. We're open. Come on down to the resource center. Whether you're looking for services, you can come as a guest, or if you're on behalf of an organization, if you want to collaborate, or if you want to stop by, check out the space and see if you'd want to sign up weekly or monthly or as needed to utilize this space and to provide services and resources. Like I said, we play nice, and we want to collaborate, and the more we collaborate, I think the bigger impact we can have.